Happy August, Decatur. We hope everyone had a wonderful, relaxing weekend. As we all are now familiar, Governor Kay Ivey extended the current mask ordinance until August the 31st at 5 o'clock. We ask that each of us will do our part. This past week, it was announced that a cumulative total of more than 1,500 people in the state have now died due to the coronavirus. Now, just for reference, Alabama hasn't suffered more than 1,268 flu deaths in any of the last 20 years. Let's keep that in mind when we tire of the precautions and steps that we're taking daily. Vigilance is so key to our community's well-being as well as our economy. Today, we're thrilled to have with us our Superintendent of Education for the Decatur City School System, Dr. Michael Douglas. Dr. Douglas, thank you for joining us today. And then we also have with us, who's become a regular attender here, and we're thankful for that, Alabama Department of Health Administrator of the Northern District, Judy Smith. Judy, thank you for joining us again. So, current cases in Morgan County are at 2,206, which means cases increased by just over 10% this week. The number is going down, and that's good news. You can look at Bama Tracker and see the cases per day, and they're starting to flatten. But that means that we need to have personal responsibility. We must continue to social distance, wear a face mask, wash our hands, and disinfect. We have to do these simple tasks to keep ourselves well, keep our families healthy, and sustain our local economy. Please remember that as far as City Hall, if you have business to do, oftentimes that you can save a trip by making a phone call or an email. Send an email to the department that you need to do business with, and it might be able to save you a trip. A reminder, if you haven't already done so, to please complete your census at my2020census.gov. That's my2020census.gov. We do this every week. It's because it's important that you need to call someone in your neighborhood and check on them. And don't do it tomorrow, do it today, and give special attention to our elderly residents. So with that, I'm going to turn to my left. Dr. Douglas, thank you so much. It's been a while since I've seen you. Glad you're here. School's ready to return here in Decatur.
Thanks for having me.
Sure. Share a little of what's going on.
Obviously, this week our teachers will come back August 5th. A little bit different. We will be foregoing Institute. We'll do that virtually, trying to do the best we can to keep our teachers as safe as possible as we attempt to return to school. We'll have some virtual trainings throughout the week, and then obviously our start date is August the 12th. That's when we'll return to school. Obviously, we are monitoring the Alabama Department of Public Health levels. We've published our plan. Obviously, if we're green, yellow, or orange, then we'll have in-person school. But if we were to go to the very highest level, then we would transition to our virtual model. Our virtual model would also include some small groups coming into the building so that we could service our student population that is of the most need. But we appreciate the community's help in wearing those masks and keeping the whole county's level down, because that certainly impacts us. So please do your part.
Thank you, Dr. Douglas. Ms. Judy?
Well, first of all, it's nice to be here. It is nice to hear a little bit of good news. I will say to you also, happy August. I would also say to you that it has now been 20 weeks since we had our first case of COVID in Alabama. It seems like it has been 20 years, and I think most of you folks would agree with us. We've missed out on a lot. We've missed out on our regular Easter, our regular Mother's Day, our regular Father's Day. We've missed out on so many things. We've missed out on family vacations, trips to, well, everybody didn't miss out on trips to the beaches, but we've missed out on so many things because of this situation. And sadly enough, it's still not okay. Going back to what the mayor said earlier in the report that we had, the most flu deaths that we have had in a year has been something over 1,200 for the past several years. And right now in Alabama, we already have 1,576 deaths from COVID, and that's in that 4.5 months that 20 weeks, that 143 days, whichever way you prefer to hear it. Right now in the United States, we have 4.7 million people who have been diagnosed with COVID. We have 157,000 who have died. Now, I want to compare that a little bit to 1918 because we've talked about the history of that. You know, in 1918, in the big flu pandemic of 1918, which we hope will continue to be the senior flu epidemic, there were roughly 675,000 people who died in the 2 years. In an era where we did not have vaccine, there was an expectation to have a vaccine, and yet people did what they had to do and what they needed to do in order to be safe. And if I remember my math, if I multiplied 4 times that, and if I took that as a 6-month death toll, we're pushing that right now. If we don't get it together and keep it together, we're pushing to that same level. Right now, if you look at the dashboard, the Alabama Department of Public Health dashboard is going to tell you that there is over 88,000 folks who have been diagnosed with COVID in the state. I will tell you that by the time we leave this room, that dashboard is going to say 90,000. Right now, as we've already said, there's 1,576 deaths in this state, and that too will go up. Morgan County, as you've already said, Mayor, has 2,206. We also have 15 deaths, and to be very upfront with you about it, that's 2 more deaths than we had when we were talking last week. And that's 2 families that clearly are devastated. I will tell you some of the good news is that the hospital rates are kind of even. That's the good thing, that we've got about the same number of people in the hospital, but we still have a huge number. Across the state, there is over 1,500 people that are in the hospital today. Now, one of the problems with that is, again, good news is a lot of people are going home. The bad news is a lot of people are still being admitted. And I will tell you that, you know, the folks that are being admitted are sick. They are sick folks. It's not just, you know, a visit thing, that they really are sick and seem to be sicker than they were before. And yes, the demographics are still very much like they were, but for some of us, 65 and 70 is a lot younger than it used to be. The other good news is we do have 2 things that we can do, 2 things that very much we can do. The first one I have decided to term, since you all don't like, I get told every weekend that we're sick of you telling us to wear a mask. So we have a new treatment. It's called MDS. It's mask, distance, and sanitize. So that is the treatment that we will continue to emphasize both in our schools and our public, the MDS. The other thing that we now have available to us is the remdesivir, which is a treatment that generally is reserved for those folks who are sickest, but we're finding great success with it. It's actually doing very well. And right now, we're okay with getting it. We just need to stay that way. So what's the bad news? What are the things that we're most concerned about? We continue to be tremendously concerned about our health care, the impact to the healthcare system, both the number of people who are in the hospitals, as well as how sick the folks are in the hospitals, and quite honestly, the drain on our staffing and our healthcare system. A lot of our folks in the healthcare system, and even in our first responder system, you know, have either had COVID themselves, or they have a family member and therefore they're isolated, or they're just flat worn out from the continued process of this. Another issue that we have right now that you need to be aware of is there are some concerns about testing. As numbers have continued to climb, there have been more and more requests for tests. As a matter of fact, I was talking to somebody, fortunately they were in Talladega, that somebody called our office from Talladega this morning. People don't know that Decatur's not next door to Talladega, but anyway, and the gentleman told me that he had been in line for almost 4 hours. He said there's already a line of people waiting to get tested. As more and more people are getting tested, there's more and more demands on the testing centers. Quite honestly, there's also more demand on the laboratories, and one of the big issues that we're having is the turnaround time to get test results back. And quite honestly, people just get fed up and they don't want to stay at home. Folks, we got to stay at home. We got to stay. If we're going to take care of each other, we're going to have to do what we have to do. but there's delays in getting results. And the other thing that I really want to emphasize is that you don't need to be retested. Once you have been positive, once you have been given your quarantine guidelines, once you've got the information you need, you do not have to be retested to go back to school, to go back to work. Once you have complied with the rules as they are, then you have completed your quarantine, and by all guidelines, there's no reason that you cannot go back to work. Thirdly, and probably the most important thing, as already has been discussed from Dr. Douglas, we are going back to school. First of all, I want to say something. I want to thank a teacher somewhere that I'm even sitting here. If it had not been for a teacher, I don't think any of us would have been here. Somebody who saw things in us that even our parents didn't see. Now, our parents, I had wonderful parents, and they were extremely encouraging, but I had teachers who saw things in me when I was being contrary that I did not see, that encouraged me on. Our kids are in that same boat. Our kids, one of these children that Dr. Douglas is going to have is going to find the next cure for cancer. That one of his kids is going to find the next rapid treatment for the next pandemic that comes along that I'll be in the home and I'll really have to worry about. But, one of these kids are going to do this. We need so much to support our teachers, and I want to thank you myself, Dr. Douglas, for all the things that I know that your school has done. Quite honestly, I'm not sure that they're not a safer environment than most of the environments we have in the community. I can promise you they're safer than Walmart. They're safer than the getting together, many of the things that folks have done. Let me say, one of the huge lessons that we have learned is one of the biggest problems we have is people congregating together, whether it's a congregate situation, a living situation, or whether it is in where they have to live, like a long-term care facility. That is one of our biggest situations because there's so much difficulty with distancing. But we can handle this. Folks, in 1918, we had a situation, again, where people, didn't have the media like we have right now. They didn't have, which is not all bad, but they didn't have a lot of the things that we had, and we got past it. We got through it. We got to where we are right now. Today, we have more technology, more media, more capability, and there is no reason we can't do better. We simply have got to make a decision that that's where we want to go. And I would like to say, as a final thing about the media, listen, forget about Dr. Google and forget about Dr. Facebook. If there was any way that I could channel all of the misinformation and all the people who are stimulating panic and all the discontent about that it's a conspiracy. It may be a conspiracy, it's not, but if it is, we've still got people dying. We've still got people getting sick. We've still got people afraid to go back to school. We need to do what we in the year 2020 are fully capable of doing, and that is protect each other, protect ourselves. You may not be able to control what other people do, but you certainly can control what you do. We are in it together. That term has sort of been overused. I will say we're all in it together as far as the consequences. I'm not sure that all the time we're all in it together as far as the prevention, but it is my belief, based on history, based on the pandemic of 1918, we will live with this in the future. This is not going to go away tomorrow. We're going to need to learn to live with it. We are going to have a vaccine. Things are going to be better. But we need to do what we need to do to take care of our people right now. I want to add a couple of other things just as a footnote, and it goes back to the schools. We are facing flu season. Flu season, we do not need folks with a lot of flu. We don't need those 1,200 and something deaths added on to what's going on with COVID. We certainly don't need our kids in the school to have measles, mumps, and chickenpox added on to what's going on with COVID. Please don't forget, in the middle of all this, your children do need their school vaccinations. they still need to be protected. We've come a long way. You know, I think, unfortunately, that was a cigarette ad, so I probably don't need to use it, but we have come a long way, baby. You know, the children that worried so much about conditions early on don't have to worry about them anymore. And we will, again, can get through this together. Again, my commendations to you for all that the school has done, and public health intends to walk with the school system every step of the way to be sure that your children are safe, and so that that child someday will find the cure for whatever it is they need to find the cure for. Thank you so much.
Judy, thank you. Thank you. So now we'll take some questions. No questions? Okay, well, excellent. So our next press conference will be Monday, August the 10th at 10 a.m. We would invite you to return this evening at 5:30 when our city council will convene for a pre-meeting, and then a city council meeting tonight at 6 o'clock. You can watch that via the YouTube channel, and we hope you'll join us. Thank you to our guest, and best wishes on getting school started. I know you'll do a great job as
Absolutely.
educators.
Thank you.
Thank you, Judy, for
You're
what
so
you do.
welcome.
Have a good day.